The video presents the tragic story of Ashish and Versha, whose twins were mistakenly declared dead shortly after delivery. In a shocking twist, they later found out that one of the twins was alive while returning home. According to a report highlighted in the video, 40% of hospital scams occur in government hospitals, while a staggering 60% take place in private institutions. This statistic reveals the pervasive nature of the issue across the healthcare system. The discussion raises critical concerns about health insurance, as hospitals may exploit patients with coverage by recommending unnecessary tests and treatments. This systemic malpractice prioritizes financial gain for hospitals over the well-being of patients. Hospital staff often plan unnecessary tests and treatments to extend patient stays, reflecting a systematic strategy to profit at the expense of care. This unethical approach is alarmingly common in private healthcare facilities. The administration of a contraindicated medication notably worsened the child's condition, highlighting a severe lack of medical ethics and accountability within healthcare. Such negligence poses significant risks, potentially leading to fatal consequences. Various scams, including unnecessary tests and inflated medication prices, are strategically designed to exploit patients financially. Therefore, raising awareness about these practices is essential for protecting patients. Physicians frequently prescribe branded medications despite the existence of more affordable generic alternatives, often influenced by commissions from pharmaceutical companies. This practice raises serious concerns regarding the integrity of medical advice. Hospitals commonly inflate medication prices, charging patients much more than standard market rates. Such markups can result in patients being significantly overbilled for essential treatments and medications. A case of exorbitant billing at a hospital illustrates this exploitation, where patients faced outrageous charges for basic items such as syringes and gloves. These practices underscore the urgent need for transparency in healthcare costs. The rising rates of C-section deliveries in India highlight a concerning trend, with 49.6% of private hospital deliveries performed via C-section, far surpassing WHO recommendations. Real-life cases, such as Sakshi's distressing experience following a forced C-section, underscore the potential hazards of unnecessary surgical interventions during childbirth, prompting ethical questions in healthcare. The use of synthetic oxytocin to hasten labor can elevate C-section rates as it often induces severe pain, complicating natural delivery for many women. The HPV vaccine controversy raised significant ethical concerns, as vaccines were administered to young girls without proper consent, leading to severe side effects and even fatalities. This emphasizes the critical importance of ethical standards in clinical trials. Reports highlight that an alarming 95% of uterus removal surgeries performed in private hospitals are unnecessary, jeopardizing women's health for financial gain. This statistic reveals a disturbing pattern in women's healthcare practices. A recent case of medical negligence involved a child being mistakenly circumcised instead of receiving a tongue tie surgery. This incident underscores the urgent need for clear communication and informed consent in medical procedures. An alarming situation in Uttar Pradesh emerged when 33 individuals contracted HIV due to a quack doctor's use of contaminated syringes. This incident exemplifies the dangers associated with unregulated medical practices. Pharmacists also contribute to the growing issue by dispensing medications without proper oversight from qualified medical professionals. This practice can mislead patients, prompting them to forego consultations with qualified doctors. Patients are encouraged to seek multiple opinions to ensure accurate diagnoses and to maintain transparency regarding medical billing. Being proactive is essential in mitigating the risks posed by unethical practices within the healthcare system.